Hello, and welcome to an informational lecture on the advanced hybrid cohort of the Practical Nursing Program. My name is Dr. Michelle Crum, and I am the director of the Springfield Practical Nursing Program. In March of 2022, the State Board of Nursing approved a proposal to add a cohort to the Springfield Practical Nursing Program. This cohort allows students with very specific clinical experience to utilize a slightly different track to achieve their practical nursing certificate and then be eligible for practical nursing licensure. So what exactly is the advanced hybrid cohort? I will go into depth on all of these points throughout the rest of this informational lecture, but in general, it is a cohort designed for students who have very specific clinical experience, namely EMTs, nurse assistants, and medical assistants. You must meet all eligibility and admission requirements, which I will outline momentarily. It is offered once a year on the Springfield campus in the spring semester. That's the start of the program. So it goes spring semester, summer semester, and fall semester. You begin in January and you graduate in December. And as I mentioned, all in-person class meetings, aside from clinical, will happen on the Springfield campus. All right, let's talk about who is eligible for the advanced hybrid cohort. I'll begin with EMTs. EMTs must be licensed in the state of Missouri and must have at least 2 months of approved work experience within the last 2 years by the application deadline. So what's approved work experience? I'll go through that shortly. But you have to have 2 months of work experience within the prior 2 years. So our application deadline is October 1st of every year, and within 2 years prior to that, they have to have at least 2 months of work experience. If you are from out of state, you must have received your certification through the National Registry at some point in time, whether or not it's still active, and must be licensed in your current state. So for instance, if you took your National Registry certification and received that, and you're currently licensed in the state of Arkansas, but you didn't keep your National Registry up, that's okay, as long as you had it at one time and you can show us that, and you're currently licensed in your current state, you would be eligible. Now let's talk about medical assistants. To be eligible for this cohort, medical assistants must be certified by the American Association of Medical Assistants, the National Health Career Association, or the National Center for Competency Testing. If you have a certification from another entity, please contact the Health Sciences Office because we will look into that and see if it meets our guidelines. I won't guarantee that it does, but we will at least check into that for you. You must also have at least 2 months of approved work experience within the last 2 years by the application deadline of October 1st. Now, as a caveat, I will tell you, if you did your CMA certification through OTC, because with OTC's program, the very end of that is certification. So if you did that through OTC, you would meet this part of the eligibility requirement. Our last group eligible for this cohort are nurse assistants. Nurse assistants who are certified by the state must simply have that same 2 months of approved work experience within the last 2 years by the application deadline. However, we are also aware that our larger hospitals train nurse assistants, or sometimes they call them patient care assistants, who are not ever actually encouraged to go on and get their state certification, although they've completed very similar training. Those nurse assistants who are not certified must have at least 6 months of work experience within the last 2 years by the application deadline, and that work experience must be in acute or long-term care, but they then would also be eligible for this cohort. I keep talking about approved work experience. So what kind of work experience is required for this cohort? For EMTs, certified medical assistants, and certified nursing assistants, the 2 months of required work experience may come from any of the following: emergency services like ER or ambulance services, acute care where you're working in the hospital, on floors in the hospital, long-term care where you're working at any type of nursing home or rehab facility, or ambulatory care where you're working in any type of clinic or physician's office type setting. However, it is noted that your primary work responsibility must be direct patient care in order to be eligible. You can't be a certified nurse assistant who's working as a unit secretary on a floor in Mercy or Cox, or you can't be a receptionist in a clinic as your primary job and be eligible. You have to have direct patient care as your primary responsibility. For non-certified nurse assistants, that 6 months of required work experience may only be from acute care, like the hospital, or long-term care. And again, your primary work responsibility must be direct patient care, not anything administrative. Now that we've determined who's eligible for the cohort, let's talk about admission requirements. The first and foremost are the prerequisite courses. There are 5 prerequisite courses that you must complete with a grade of C or better in order to be eligible for the program. Those courses include English 101, which is composition, Psych 110, which is just an intro to psych course, BCS 132, which is health science nutrition, and then BCS 165 and 205, which are anatomy and physiology respectively. It is important to note that your sciences, so your nutrition, anatomy, and phys, cannot be more than 5 years old. So if you took those a couple of years ago, that's fine, as long as it's not more than 5 when you start the program. And it's also important to note that your grades in both anatomy and physiology will contribute to your overall admission score. So that's something to keep in mind. All courses may be taken in one 16-week semester if you choose to do so. Now that's 17 hours, so that's not going to be a light load, but you'll have almost that for some semesters in nursing school. So it would give you a good gauge of, how much workload those courses would be. Anatomy and physiology are usually offered in A and B block format, so first 8 weeks, second 8 weeks. So if you wanted to do that, you would have to take anatomy in the first 8 weeks, physiology in the second 8 weeks. And then the other 3 courses you could decide to take as, A or B block courses or just regular 16-week courses. But they can all be completed in one single semester if you so choose. It's also important to note that your overall GPA does contribute to your admission score. So while you're never required to get more than a C on any of those courses, obviously the better you do on those courses, the higher your GPA, the higher your admission score. The next requirement are references. You will be asked to provide 3 professional references, one of which must come from your anatomy or physiology instructor. One may come from your healthcare employer. So wherever you had that 2 months of healthcare experience, or if you're currently employed, you could just get that from your current employer. And then the third one can be any other professional reference of your choosing. The next is the HESI. The HESI is an entrance exam that we offer to students. You can take it online. So the nice part about that is, if you don't want to come to campus for that, you can take that online. You must score at least a 70 on the HESI entrance exam to be eligible for admission. And again, the higher your score, the higher your admission points. There will also be a work experience verification form that you must provide to verify that you have approved work experience and that you're truly eligible for the cohort. And the application deadline for the cohort is October 1st. Now, if you look at the traditional cohort, what's missing off of this list? The traditional cohort has to take something called a behavioral assessment. We waive that for you because you are already working in healthcare. So that is one of the benefits of this cohort, is that requirement you get to waive. I'm going to try to give you an overview, a very basic, non-in-depth overview of some of the program and course requirements for this cohort and compare them a little bit to the traditional hybrid. So at Springfield, we are all hybrid, whether it's the traditional cohorts or this advanced hybrid. And what that means is pretty much all of your theory content, your didactic content, is delivered in an online format. Now we bring you in for class activities and labs, but even those are pretty limited and they're usually maybe like a 2-hour block at a time. There are a couple of exceptions, but for the most part, it's a 2-hour block that you might be coming in for. The advanced hybrid cohort comes in maybe slightly less than the traditional. There will be a couple of things that you don't physically come in for that we require the other cohort to come in for. But for the most part, when you're doing your labs or you're having to do checkoffs, a lot of those are done in an open lab type of format, so you'll have a little bit more flexibility with your scheduling, but you still have to schedule. You still have to come in, you still have to do it. And the way we do checkoffs in fundamentals is we do videos, and you record a video, which you can then view and make sure it's in good shape before you submit it. And then we do our checkoffs for the most part in that fashion. When you look at OTC's schedule, if you look at our courses, you're going to look at these blocks of time that look like 3 and 4 hour blocks of time that you are going to be physically in class. That's actually not true. What that means is those times are blocked for when you come to class. So we ask that you keep them open so that we are going to schedule your class activities during those times. But when you start an 8-week block, we give you the class activity schedule for that entire 8 weeks. So you will know when you are required to be physically present right at the beginning of the 8-week block for any in-class activity. So don't look at the times on the OTC schedule and go, oh gosh, there's a 4-hour lab on this day I've got to be present for every day. No, what that means is there's a 4-hour block of time where we might schedule lab, and more than likely you're going to have a 2-hour time frame in there on the weeks that you come, and that's how we will handle that. It'll make more sense, when you're actually in the program. But like I said, we give you that program schedule kind of at 8-week blocks, so you know in advance of what you're going to be doing. I also want to just take a moment to mention our math requirement. In the OTC Springfield Practical Nursing Program, you will be required to do basic operation math without a calculator. So you will not be able to have a calculator when you do basic addition, subtraction, multiplication, and division. So if you're not a fan of long division, you're going to have to reacquaint yourself with that. We have very helpful videos that show you how to do that. So if that's not your jam, that's fine. We've got some tutorials that'll help you brush up on those skills that you learned. They're in there, you just have to bring them back to the surface. But even our math classes, they're scheduled for every week in person. But if as a whole, the cohort, the group is doing well with math, after about the second week, then we'll transition to online for even our math lectures. So just to understand that all of these things will be on this calendar. You'll know when you're expected to be there, and some things where you're expected to be there, you might end up getting excused from if the teacher chooses to turn that into an online activity. The one thing to note is, just as with your prereqs, all courses must be passed with a C or better to remain in the program. And within each course, there are pass-fail items. So there can be exams that are pass-fail, there are checkoffs that are pass-fail. It should be noted that anything that's pass-fail, you always get more than one attempt to complete it. But you have to complete them successfully in order to remain in the program. Now let's talk about clinical. Here's where some of the differences really show up in this advanced hybrid cohort. In our traditional cohort, in fundamentals, they have 1 clinical day a week, but in all of Med-Surg 1, Med-Surg 2, they are going to have 2 clinical days a week, okay? In this advanced hybrid cohort, no matter if it's fundamentals, Med-Surg 1 or Med-Surg 2, you only have 1 clinical day per week. In fundamentals, it's a 6-hour clinical day. In Med-Surg, it's a 12-hour. And the way we work it is for the first half of the day, the first 6 hours, you will take care of 1 patient, and then you will switch patients at the halfway mark and take care of a different patient. So it gives you more patient contact, but you're condensing that all into 1 clinical day. Because you're only doing 1 12-hour clinical day, as opposed to the traditional cohort doing multiple 8-hour clinical days, your clinical time is reduced by about 25%. Now, clinical is pass-fail. You have to meet all objectives. So you're going to still have to meet the same objectives in that shorter period of time. But the idea is, since you're already experienced, you're bringing some things to the table, and you should be able to meet those clinical objectives because of your clinical experience in that shorter amount of time. You also will enjoy fewer paper clinical assignments. However, if in the traditional cohort they're doing 2 major care plans for a clinical group and you're only doing 1, that means it's higher stakes. You have to do well on that 1 because you have to meet the pass-fail requirements. So it's a little bit higher stakes. Our focus on our clinical scheduling for this cohort we're going to try to get all of our clinicals done on either Fridays, Saturdays, or Sundays. So we're going to concentrate them on weekends to try to keep more weekdays open so that if you have to work, that's time available to get that done. So I can't guarantee that we'll be able to achieve that. But usually when we're asking for Saturday and Sunday clinical days especially, we don't get a lot of competition for those particular clinical days. Students always ask me, and they want me to quantify this for them, and I simply can't do it. How much can you work? Well, the answer is that depends. I would ask you to use your assessment skills to determine how much you can work. Now, let's take this in pieces. The first 16 weeks of the program, you are actually only taking 9 nursing credit hours. 9 credit hours in 16 weeks. So that's not terrible. You can probably work a couple of days a week for sure with that and manage that without too, much difficulty. However, when we get to the third 8 weeks, which for you guys would be summer, and then the 4th and 5th, which is fall, that jumps up considerably. In fact, in the summer, in basically a 7.5 week semester, you are taking 7 credit hours. And if you don't think that is a huge uptick in work, just wait till you get there. So if you approach this with common sense and say, maybe in the first 16 weeks I can work a little bit more, or there are times when I'll look at the schedule and I'll know that there are times when I'm really busy and I need to back off on work a little bit but then there are times when I'm on break or I have lighter weeks and I can pick up some additional work hours. That's looking at it in, using your assessment skills and using common sense. Obviously, we have breaks throughout the program. The only break between A and B block of first semester is spring break, but between first semester and summer, there's like a 3.5 or 4 week break where you can, pick up some additional hours and hopefully, help out that way. Summer will be very busy, those 8 weeks, but then there'll be another 3 or 4 week break between, it's at least 3 weeks between summer and fall semester. So again, if you plan for it, that's going to help things quite a bit. If you understand that when your credit hours goes up, the time you are going to need to spend studying is also going to go up. And by the way, watching the lecture videos, that's not studying. That's getting the information delivered to you. Studying is what you do after that to make sure that that information stays in your head. So I would encourage you very much to speak with your employer in advance and give them this knowledge, because most employers will work with you about scheduling or time issues if they are told in advance. And like I said before, there are days when we have a lab scheduled and it's like a 2-hour lab. Well, if you have any flexible scheduling whatsoever at work, you might be allowed to just leave and go to that activity and come back and not necessarily have to miss an entire day of work just because you had a 2-hour activity. So talk to your employers, see what they're willing to do, see how they're willing to work with you. Because here's the thing, they know that at the end of it, they might get a nurse, an LPN rather than an EMT, a CNA, or an MA. So that might be attractive to them. It may not, but you can kind of entice them with that information. Also, I would highly encourage you to look into and utilize all OTC resources that are available to you, to include applying for scholarships, because that can help you manage the financial burden and might make cutting back your work hours a little bit more feasible for you in order to, get this program successfully completed, but meet your financial obligations. And through our foundation, a lot of times when you're applying for a scholarship, it's kind of a deal where you can do more or less one application and it applies you for multiple scholarships. So that's a really nice feature of our scholarship opportunities here at OTC. To finish out this informational lecture, I wanted to try to answer a couple of things that tend to be frequently asked questions. Now, these won't necessarily be any different than they would be for the traditional cohort, but since we're here, I just want to make sure that I'm being very clear. The first of which is completing the practical nursing program is not a guarantee that you are eligible to take the licensure exam, okay? Only the State Board of Nursing can determine your eligibility for licensure. Now, one of those requirements by the State Board of Nursing will be to complete a Missouri State Board approved nursing program, which we are. But they're going to look into other things. They're going to look into your criminal background and some other areas that they will look into to determine your eligibility for licensure. So I just want to be very upfront and tell you that that is not guaranteed. Our current program pass rate, as I am doing this lecture, it's the spring of 2022, so I have for the 3 years prior, 2021, 20, and 19, we have a 100% pass rate. What that means is in the Springfield Practical Nursing Program, every student who graduated the program and sat for boards passed it the first time they took it. Now, as time goes on, you might want to keep up with our current pass rates. Well, you can always find that on the State Board of Nursing's website. If you go on that website, they have pass rates for every nursing school in the state of Missouri. It's very transparent. You can find that easily. And then I'm always asked, well, where can an LPN work? LPNs are really being well utilized in Southwest Missouri. Not every facility uses them the same way, but if you look at this region, okay, there are acute care opportunities for LPNs. That means working in the hospital, even working in ICUs, labor and delivery, ER. Those are all opportunities that are available to LPNs right now. Working in long-term care, certainly. And a lot of times even the pay's even a little higher there because they're needing it, so they offer, you know, more salary and benefits sometimes. You can work in ambulatory care, so in a clinic or a doctor's office. And some of this too comes down to what's important to you. Is it important about where you work and what you're doing, or is it more important that your hours match your family? So do you need to work in a place where you can work for the most part Monday through Friday, maybe have holidays off, weekends off? Well, then a clinic might be a fantastic option for you because you're still going to get paid a competitive salary, but you're going to have, you know, your hours are going to be daytime hours for the most part. It's going to be maybe no weekends, maybe no holidays. So that can be, you know, something that's very attractive to somebody, and that might be more important even than salary. But really, when you look at it, you've got all of those options plus even some home health care. Now, home health care a lot of times does focus on wanting RNs, but there are LPN jobs in home health care as well. So really, it just depends on where you want to work and what fits with your life. Because once you are a licensed nurse, you have a lot more career opportunities that are open to you. Okay, I hope that wraps up the information and answers most of your questions. As we move forward, we will likely be having some additional informational sessions. You will also probably have an assigned health science navigator before too much longer that can help answer these questions. Our health science office can help answer questions. And of course, I am always available to answer questions. If you email me, I will get back to you as soon as I can. I do get a lot of emails, but if you're a little patient, I can get back to you within a relatively short period of time. So let us know if you do have any questions, and hopefully we'll be seeing you before too much longer in class.